Here I made a prezi to show some STD rates. This is the main page. And here we have a little graph showing a couple of STD rates in gender and age range. We can see that in chlamydia, females have a much higher rate than males. And also in the younger generation of females, they have more gonorrhea, but males have more in the older age range. And then in syphilis, we see that a lot. It's trending a lot in the male category, as well as AIDS. Also, AIDS is more prevalent in the older age groups. Here's another with about some statistics about how many people were diagnosed with these different STDs. Here's another chart showing STD rates over the years. This is just a general infection rate showing different STDs that people were infected with, no specific one. And you can see that people began contracting more STDs as the years went on. It went down a little bit in 2004 and 2006, but then overall it raised higher. If we use community engagement methods and partnerships to build local STD prevention and control capacity, the purpose of CAR's program that there is to lower the rates of STDs project is to support the planning, implementation, and evaluation of innovative interdisciplinary interventions to reduce STD disparities, promote sexual health, and advance community wellness. And also I had a video here.
A large proportion of people who get various sexually transmitted infections never know it. They never develop symptoms. And that's important because you can't tell if somebody's got an STD by looking at them, and I can't tell I've got an STD by how I feel.
Very often when I diagnose a sexually transmitted disease in a young person, they say, "How did I get it?" I say, you know, they don't come with people's names on them. So I don't know how you happen to get it, but the problem is you didn't protect yourself.
Sexual responsibility is really important. I have responsibility to myself that I'm getting tested, as well as responsibility to my partners, making sure that they're tested.
When you give your body to someone else, you're giving them full control over your life. Protect yourself. Make everybody use a condom.
Condoms work very well to prevent HIV and trichomonas and gonorrhea and chlamydia. Condoms can't protect against diseases that are spread outside the area that a condom covers, such as herpes or syphilis or genital warts, the HPV virus. It's really important to use them all the time, including for oral sex.
Ask all the right questions before you get involved with someone physically, and use the very best judgment that you have with regard to the possibilities of being intimate with someone.
Telling your doctor about your behavior when they ask and telling the truth is so important.
Getting tested is very simple and it's an easy process. For gonorrhea or chlamydia infections, all you have to do is provide a very small sample of urine. A quick and easy blood draw can accomplish syphilis and HIV testing. Sexually transmitted diseases like gonorrhea or chlamydia, these are bacterial infections that can be easily treated with antibiotics. If it's a viral sexually transmitted infections like herpes or human papillomavirus or even HIV, these conditions can be managed with medical care.
Abstinence and limiting partners, having a monogamous relationship is really the best way to try to protect yourself and prevent having these diseases.
Talk to kids when there's an opportunity. Bottom line is, start talking to them about it early. Give them the ammunition to deal with the peer pressure and the partner pressure that they are going to experience.
So what's a reasonable way for someone to respond to having been diagnosed with sexually transmitted disease? I like to think about them as 4 Ps. First of all, perspective. It can be frightening, it can be demoralizing, but keep perspective about it. This is, in most circumstances, going to be an easily manageable problem. Number 2, take care of it. So see your provider and get it dealt with. P number 3 is your partner. You may have transmitted it to somebody else. They may need care and treatment as well. And then finally, prevention. What can you do to enhance your sexual health in the future?